who thought that a minor case of unknown pneumonia, detected in 41 residents of Wuhan, China would start a pandemic so huge, it would cripple the healthcare infrastructure of the world, quarantining 7 billion population in their homes and changing the world forever. It was evident from the very start that every country would be affected by the pandemic, some sooner than later. What made the difference was the approach they took in handling it, whether they were proactive and confident, or reactive and confused. And now as we enter June, the number of people affected is crossing 5.7 million with around 360,000 deaths. It is important for the sake of history that we take a look back at all the precautions countries took and are still taking to deal with this pandemic. Number 10. Restricting large gatherings. One of the first things we became aware of when we began to understand the intensity and severity of this disease was that it was an airborne virus that spreads through coughing, sneezing, or droplets of saliva. So, it was only natural that one of the first steps that countries like China, New Zealand, Singapore, and others took to curb the spread of the virus was to place an indefinite ban on public gatherings. The severity of the ban largely depended on the situation prevailing in the country at that point, but this provided them with an opportunity to further examine the situation and take expedited measures to control it. And as the results have started to show, it did prove fruitful as it restricted the cases of local transmission in most countries. Number 9. Measures for work life. With most countries placing a ban on traveling and large gatherings, it led to a spike in unemployment as most daily wagers lost their only source of income, and most corporations moving towards downsizing. According to the UN's International Labour Organization, COVID-19 could cost 305 million people their jobs with no hopes of getting employed again soon. Most countries moved to protect their workforce and stopped organizations from firing their employees. Many countries allowed people to work from home and supported the unemployed with different benefits so that they can maintain their livelihoods in this time of financial instability and restrict them from leaving their homes. This became an integral factor in the spread of COVID-19 as people could stay home without worrying about their jobs and income. Number 8. Healthcare system. It may seem a little ironic since we mentioned above how COVID-19 destroyed the healthcare system of most developed countries who were not prepared to fight this deadly disease. But a good healthcare system also protected and favored most countries like Germany, where a well-positioned healthcare system allowed them to form an effective nationwide response, whereas most countries were unable to provide protective gear to their doctors, which only worsened the situation. Countries with sound and efficient healthcare systems were able to mobilize their medical force better, providing them with performance-based payments and required medical equipment. These countries are also in the supply of the masks and gloves and are better able to provide free-of-charge tests to the people. Number 7. Restricting mass mobility. Countries that were severely affected by the virus have adopted different policies to fight it depending on the situation prevailing. Countries like Italy and Spain announced the curfew but a little too late. UK went for soft restrictions, whereas Israel, Brazil, and Portugal decided not to implement a curfew. But it was clear that no good could be achieved if an immediate halt to mobility is not imposed. Even though drastic and aggressive, it helped in stopping the transmission of the disease. Borders closing, inter- and intra-countries flights halting, restricting transportation and travel put all the activities of daily life to a still. Passenger traffic, by all means, was dropped to a new low. But this provided the government with an opportunity and space to somewhat restrict the number of cases and prevent further spreading. Number 6. Relying on good science. This is one lesson that the world can learn from New Zealand, who is the 5th country to be declared COVID-19 free. A constructive combination of effective leadership and science is what countries like the United States can use in their fight against the disease. What New Zealand did right was that it implemented a very strict lockdown before even one death was reported. It banned entry in the country to all the foreigners. The leadership of New Zealand followed what different health organizations, medical, and scientific staff have been saying around the world for months and put the health and safety of its people ahead of its economy, which so many countries failed to do and now are bearing the brunt of it. Number 5. Disinfecting. One of the most effective ways that different countries are using to fight the spread of the virus is to disinfect surfaces and areas that are prone to high contact. These areas include state buildings, markets, airports, religious places, and public roads. Workers in proper gear are spraying bleach from robots, trucks, guns, and drones in China, South Korea, Iran, Iraq, and the UAE. While one can argue on the effectiveness of this measure since people spread through touch and people are rarely going to touch the city streets with their hands. But a more plausible explanation behind disinfecting must be about administration being seen as actually doing something to curb the disease or based on the belief that disinfecting streets might build trust in those responsible and help recede the anxiety somewhat. Number 4. Testing and tracing. This was the measure used by South Korea, who was exceptionally prepared to handle the COVID-19 outbreak. It used the technology in its favor and made sure that all the foreign visitors report any symptoms of the virus to the government immediately. Even before the World Health Organization started insisting on the importance of aggressive testing, South Korea was testing 12,000 people on average daily. The government also introduced different waistbands for those who would violate their quarantine and put others at high risk. It not only tested the population vehemently, but it also tracked them, isolated those who were affected, all the while treating the infected. The government also put out a policy urging people to change their lifestyles and defining instruction for physical distancing. Number 3. Promoting hygiene. One of the basic precautions that were communicated by the health organizations at the beginning of the pandemic was to wash hands regularly and maintain their hygiene. They also recommend avoiding touching your face and nose because, as mentioned above, the virus is airborne and spreads through touch. Face masks were also promoted by the government and became somewhat synonymous with the fight against the outbreak, but it is important to mention that, as numerous studies suggest, they do little to curtail the virus when you're healthy but plays a significant role when you're sick yourself or around someone who is. This measure did not help in restricting the virus but helped a lot in creating awareness among the population about the pandemic. Number 2. Social distancing. This precautionary measure was the one that the government highlighted time and again. All the measures mentioned above somewhat revolve around the importance of social distancing. All those countries whose people were able to social distance effectively were able to fight the pandemic in a better way. Those who failed to do so had to move towards curfew, quarantining, and lockdown. To maintain and keep up with the required social distancing standards and observe the relevant standard of procedures, people were quarantined at their home. Requirements of social distancing differ in different countries depending on the criticality of the situation. Number 1. Lockdown. It is the most drastic and aggressive measure, but it also inevitable and most effective in most cases. Almost all the countries of the world are in lockdown. That means that schools, offices, malls, and public places are closed, and people are forced to quarantine in their homes for the sake of their health and safety and are only allowed to leave their homes for important chores. In most countries, police are stationed on the roads to ensure the effectiveness of the lockdown. At this point, most countries are devising plans to exit the lockdown most smoothly as the number of cases is decreasing in most European countries, but we still don't know if they have defeated the virus or just managed to pull themselves through the first round. But it is still important that we practice social distancing and stay home for ourselves and our loved ones.